if you look during my 25-year career in head and neck surgery, one of the really tremendous developments has been the emergence of human papillomavirus. So there was a time during my training in the late 80s where most patients who had oral cavity cancer suffered from the use of tobacco and alcohol. As a consequence of the sexual revolution, we now see this sexually transmitted human papillomavirus that results in cancers both in the tonsil and the base of tongue. The good news is that this is a population of patients that have a very good prognosis. The bad news is that this is a very difficult topic to address to patients. And my component of the talk today was actually talking about counseling of patients. You have a patient who has a combination of a sexually transmitted disease and cancer, and the stigma, the potential shame, the duress it puts on relationships can be really staggering for this patient population. And so it's not uncommon that I spend 45 minutes to an hour with each of these patients during their consultation. And I spend a lot of time trying to explain to them how this shouldn't change their relationship with their partner, how it shouldn't change their sexual practices, how it doesn't put their partner at any additional risk that they weren't already under prior to this event. And I think it's really a critical component of what we do. It's really important that we try to heal our patients, but I don't think we can ignore their soul. And I think that this is really a tremendous part of what we've done, and it's something that I've been very passionate about. So I think that it's a message that I personally try to get out, and I hope that I'm impacting upon other people's practices, how they interact with their patients. That is a very controversial issue. So I had made some comments in the lay press a couple years ago. There were a number of individuals, including individuals in organized medicine, who took exception, who said that there was not a level of proof that vaccination prevents the oncologic component of this disease. But all I can tell you is that I am eating my own cooking, and that all 3 of my young adult children were vaccinated. Screening in this population is very difficult. As I talked about in terms of this disease from the North American perspective, which was, again, a talk that we gave today, it was myself and my 2 predecessors as president of the American Head and Neck Society, Terry Day from the Medical University of South Carolina, Doug Gerard from Kansas University. Roughly 75 to 80% of adults in the United States have been infected with HPV at some point in their life. And our ability to screen for the disease is very limited, and our ability to develop predictive models of who will eventually develop the cancer is also at this juncture fairly limited. So the ability to screen is very difficult. I have a number of patients who end up with small papillomas on their tongue or their tonsil. There are men whose wife or spouse have known cervical dysplasia or even have had cervix cancer, and they want to be screened, and I'm certainly willing to offer that service. But in terms of objective data that shows that it really changes outcome, I think that's very limited.